You know the feeling, that one single painful spot inside your mouth that just makes eating, talking, everything a total nightmare. Well, we've all been there. So in this explainer, we're going to break down what that sore actually is, what's behind it, and most importantly, how to get some relief. So let's jump right in. I'm going to go out on a limb and say the answer for pretty much everyone is a big, fat yes. It can seriously throw off your whole day, right? Whether it's just a tiny little ulcer or something that feels a bit more serious, it's just so distracting. So what is actually going on in there? Well, the fancy clinical name for this whole situation is stomatitis. But here's the most important thing you need to get. Stomatitis isn't the actual disease. Think of it more like the check engine light for your mouth. It's a symptom that's pointing to some other underlying issue. And it can show up anywhere, on your cheeks, gums, your tongue, you name it. Okay, so if it's just a symptom, what's actually causing it? That's what we're going to get into in our first section. It's time to uncover the usual suspects. Okay, so stomatitis usually falls into two big famous categories. First up, you've got aphthous stomatitis, which I'm sure you know better as canker sores. These are those awful little ulcers inside your mouth. They can be triggered by stress, biting your cheek, or even certain foods. And here's the key takeaway. They are not contagious. Now, on the flip side, we have herpetic stomatitis, or cold sores. These guys are caused by a virus, they look more like blisters, and they absolutely are contagious. That is a really, really important difference to remember. But trust me, the list of causes goes way beyond just canker sores and cold sores. I mean, stomatitis can be triggered by almost anything. It could be as simple as the wire on your braces rubbing your cheek raw, or maybe an allergic reaction to something in your toothpaste. It can even be your body's way of telling you you're low on nutrients like vitamin B12 or iron. And of course, things like poor oral hygiene or dentures that just don't fit right can create the perfect storm for irritation and infection. All right, so we have a pretty good idea of what might be causing the problem, but how do you know for sure what you're dealing with? Let's move on to section 2 and learn how to read the signs. So the experience can be a little different for everyone, but there are some classic signs. Of course, there's the obvious painful sore itself. But you might also notice some general redness and swelling, or maybe a constant burning or tingling feeling. Sometimes your gums might bleed really easily. And when it gets really bad, the discomfort can be so intense that even eating your favorite meal or having a chat becomes a seriously painful task. Now, if you decide to go to a dentist or a doctor, don't worry. The process to figure this out is usually super straightforward. They'll probably start just by chatting with you about your symptoms, your diet, any allergies you might have. Then they'll do a simple physical exam, just taking a look inside your mouth. And if they think it might be an infection or something else, they might take a quick swab or do some blood work, just to be absolutely sure. Okay, let's get to the important part. You're dealing with a painful mouth sore right now. What can you actually do about it? Let's dive into our third section, your action plan for getting some relief and starting to heal. The best way to think about treatment is in 3 simple escalating steps. You always want to start with the easiest, most accessible stuff first, and that's home remedies. If those aren't quite cutting it, you can level up to over-the-counter solutions. And then finally, for those really tough cases, you've got prescription treatments. So let's start with step 1. These are things you can do like right now with stuff you probably already have. A simple warm saltwater rinse is amazing for reducing inflammation. A little paste made from baking soda and water can help soothe the area. And this is a big one. Avoid foods that are just going to make it angry. You know what I'm talking about. Spicy food, anything too acidic like oranges, and definitely crunchy chips. Just give your mouth a little break. Now, if those home remedies just aren't giving you enough relief, it's time to head to the pharmacy for some over-the-counter help. You'll find topical numbing gels that have benzocaine in them. What these do is create a little protective shield and temporarily block the pain signals. It's also a good idea to grab an antiseptic mouthwash, which helps clear out any bacteria that might be making things worse or slowing down the healing process. And then there are those really stubborn cases that just don't want to go away. That's when it's time to call in the professionals. A doctor can figure out the exact cause and give you a targeted medication, like an antiviral if it's a cold sore, an antifungal if it's a yeast infection, or even a corticosteroid, which is a really powerful anti-inflammatory to bring down severe pain and swelling. Look, getting treatment is great when you need relief, but you know what's even better? Prevention. So in our final section, let's talk about how to build up your defenses so this doesn't keep happening. Honestly, your best defense is really just a collection of good, solid habits. I know, it's the basics, but they are so effective. Great oral hygiene is your foundation, brushing and flossing every day.
After that, staying hydrated and eating a balanced diet are huge. And hey, remember how we said stress can trigger canker sores? This is where finding ways to manage your stress actually becomes a critical part of your oral health. It's all connected.
So how long are you going to have to put up with this thing? Well, here's some good news. Most of the time, mild sores will heal up all on their own within about 1 to 2 weeks, so you can kind of keep that timeline in your head as a benchmark. And that brings us to a really important question. We know that most of these cases are minor and they go away, but at what point does a simple mouth sore cross the line into something you really need to get checked out by a professional? Okay, here are your red flags. If a sore sticks around for more than 2 weeks, that's your first sign. If the pain is actually getting worse instead of better, that's another. Or if you start to develop a fever along with the sore, it is definitely time to call your doctor. That's no longer something you should just try to wait out at home. And there you have it, our full breakdown of stomatitis. We've looked at the causes, the signs to watch for, and the whole action plan from home care all the way to seeing a doctor. At the end of the day, a healthy mouth is just such a key part of your overall health. So I'll leave you with this to think about. What's one simple step you can take today to start building your defense? Thanks so much for tuning in.